I'm Jay.
And I'm Sean.
And we watched some movies.
Yes, we did.
So I was watching this great documentary the other day. It's called In Case of Emergency by Carolyn Jones. And I'd watched a documentary of hers previously called American Nurse. And this one is in the same vein, only it is looking directly at emergency department nursing. So it looks at different emergency departments all over the US that have different challenges. Some that are more rural and have to airlift every patient in, and some that are super busy inner city hospitals. There's really a plethora of different challenges that they have. And you see a lot of mental health stuff coming in and a lot of opioid crisis stuff, that is really changing the face of emergency medicine. It used to be broken bones and workplace accidents and heart attacks. And now it's a lot of very chronic stuff. And they, in the emergency department, can only treat the really superficial right now symptoms. And they can't really provide any ongoing support.
No, it's a revolving door.
Yeah, then they're not really finding community supports to provide resources for these people. So that's difficult. And you can tell a lot of people in the field are seeing these trends and wondering why nobody's responding to them, but nobody is. And so it is very frustrating, I think, to try to just treat these sort of surface level things when nobody is trying to treat the root causes.
So then you're going to see them again because nothing will have changed.
Yeah. And so they're taking up a lot of resources. They shouldn't even be in the ER, but they're taking up so much of the resources there. It has to, at some point, compromise patient care for people altogether. So it's a moving documentary. It's great to get to know some of these nurses and how they feel doing their job. American Nurse is also really good, and you should definitely check that out. But while they're filming this documentary, the COVID-19 pandemic starts. And so then we see this further pressure on emergency departments. And I am saying emergency departments. That was the first thing we learned in this documentary, is that everybody calls it the ER, but they grew out of rooms a long time ago. These are full-fledged departments that have to deal with so many things, a lot of them not even exactly emergencies, and just sort of the triage nature of which they kind of borrowed from the army time, from war times. So it's a really interesting documentary, and it sort of hits your heart really heavy once that pandemic starts. And it's overwhelming to a lot of hospitals. Not only because it is outpacing the resources that they have to care for people, and they are losing people at an alarming rate, and of course that affects the people providing the care. But at the same time, these same people are also risking their lives, basically, to treat these people.
Yes, they are.
In the beginning, there's not enough PPE, the personal protective equipment, to go around. Nurses and doctors are exposed, and then potentially bringing it home to their families, or deciding not to see their families. So it's, I think, an important part of this pandemic that, I know in the early days people were applauding them from their balconies at certain times of day. And
that's right, yeah.
But this is a real and an ongoing problem.
It's ongoing. It's still, the numbers are increasing again. So the frontline healthcare workers are still in the thick of it, and probably have not really had a break.
And didn't really get a good break, that's right. So it reminded me of a documentary I saw at TIFF this year at the Toronto International Film Festival called 76 Days. And this was a documentary made in a hospital in Wuhan in China. They were right there as the pandemic hit. So
that's crazy.
The 76 days are the 76 days of the lockdown in the city of Wuhan. And just the crazy, overwhelmed, I've never seen hospitals like this, where the medical personnel are trying to close the doors and let only one person in at a time. And of course, they understand all these people are panicked. They see that people are dying of this. It really is very affecting. You know, they're trying to get doctors in from other places to help relieve some of the staff shortage for sure. China was also like building hospitals, just trying to cobble together.
That's right.
They didn't have enough room. They had like pop-up morgues outside. It was really crazy what they had to do just to accommodate this thing and learn about it on the fly. And it was really something to see, you know, them trying to, they would call family members and say like, oh, this person is dying. And of course, family can't visit. Nobody can visit. So they don't get a goodbye. They didn't know the family member was this sick. You know, it starts out looking like a cold or the flu, and then all of a sudden people are dying, and it just is unexpected and really hard to bear. There's no goodbyes. People can't even do funerals or pick up the bodies. And at one point we just see this bin with all the dead people's cell phones in them. And this one nurse is very diligently, you know, keeping all of these personal effects, hoping that one day things will quiet down enough that they can return them to families. Meanwhile, some of those phones are still ringing. So that really stuck with me. And it is important to remember how hard the healthcare workers are scrambling to meet the needs of this pandemic, which is, again, ramping up. And
it is important to remember that.
Right.
One more reason to take precautions.
Absolutely.
Minimize the spread of this thing.
Absolutely, yes. And that was sort of really brought home by a documentary we just watched on Amazon Prime called Totally Under Control, which is a direct quote from the President of the United States, Donald Trump.
I'm sure that's a direct quote
not just a
every
direct
week for the last 8 months.
Yes, but also like sometimes 3 times in a sentence.
Yeah.
Of course, they did not have it totally under control. It is rampant. It is scary. It is, what is the death toll in the States now? Like 200,000?
220,000-ish. Yeah. And climbing at about 1,000 per day.
Oh, man.
They had their highest ever single day cases, new cases. It is nuts.
And people are out there with no mask, just going to bars and restaurants and Disney World.
Boat parades and all sorts of things.
Yeah, this is rough going. So this documentary really, I don't think meant to be super political. It just happens that for some,
it's been politicized.
Yes. And really, we were very happy actually with the political response in our country and in our province even.
Yep. Well, we have different governments at a provincial and federal level, a center-left federal government and a right-wing provincial government.
Mm-hmm. And yet they had the exact same message and continue to do so. And take it seriously.
Makes a huge difference.
Well, the difference is, because I don't think we really need to hear from politicians. We need to hear from scientists.
Yeah.
And so the good thing about this is that the politicians have entirely left things up to scientists and have followed those guidelines. And that's the big difference. It is nice to have the leader say some words to, of hope and of responsibility and guidance. But at the end of the day, those are all taken from the doctors who are informing them.
Yeah, and it's really remarkable, isn't it, that when the medical people are giving the advice and that is being followed, suddenly it doesn't matter what party is in control, because the medical advice, while there is not a 100% agreement, there is a consensus.
There's a pretty,
And the consensus is quite stable. Certainly things are being learned all the time, but once they're learned, implement them.
Yeah.
Don't be like, well, we thought things differently before, so we don't want to change our position.
Yeah.
Change your position.
Of course.
Doesn't matter. work
it
on
will
the
change
best information that you have at the time.
Yes. And I think what Totally Under Control does well, but that makes it such a tragic watch, is really all of these scientists and doctors who are being interviewed, some of them are brought to tears just thinking about how negated they've been, how ignored they've been, how they haven't really been able to do their job, and they know that they were prevented from saving lives. And when you look at a death toll that is over 200,000 people, just remember what the death toll was on 9/11.
Yeah, 3,500.
Yeah, how much, that immobilized an entire country, got united, and it was patriotic to be, and that was not to put it down at all. Obviously, that's a terrible loss of life, but when you look at the magnitude in comparison, this is really huge, guys.
Yeah, I think that's what's lost somehow. It's and it seems to be an American issue that other countries are taking this seriously because it is serious.
Yeah, well, that's when they have to compare the states to like China and Brazil and India. And it's like, you guys are supposed to be a first world country. Like, what are you doing?
Yeah.
How are your numbers worse than all of those? Yeah. It's scary.
Yep.
And obviously it has been a top-down problem. When science has no place in this society. It's these are very measurable repercussions, and it is costing real people lives. And that's a hard thing to remember watching a documentary like this, especially because I kept saying, like, it's not over.
It's not over.
They're telling us the numbers, but it's not over. We're not done. Like, this is not a static number. We are increasing.
We are increasing. We're ramping up all over the world.
Yeah.
Most of the world has started from very low numbers that are now increasing at scary rates.
Yeah.
The US is already at scary numbers and now is going to increase at even scarier ones.
And those are just the numbers we know, because obviously, as was brought to our attention many times in this documentary, the US has been fudging the numbers all along, because Trump apparently believes if you just don't test,
then there are no cases. That somehow testing causes COVID.
He's not good at math, and he's not good at logic. Okay, those are funny things to say about a grown man, and yet it's true, and it's very disturbing, and it's not funny, because he is costing lives.
Yeah. Well, this whole response and the failure to follow medical advice.
Yeah, that's a big deal.
Failure just to wear a mask, socially distance, set an example.
Yes.
Totally lost.
And then this documentary ends with, a day after we finished filming, he got COVID.
Yeah. But the unfair thing is he gets great treatment, so he's just fine. He recovers.
That's right. They're catching it right away. They're treating it aggressively.
They're using science on him.
Yes, he should have had to just take that hydrochloride.
That's right. That's all he should have gotten if things were fair.
Be like, all right, here's the stuff that was in the fish aquarium, whatever.
That's right. You can drink bleach too, because he did prescribe that.
Sure, just swish it around a couple of times. Wow, that's really rough.
Yeah, it is. This is an ongoing thing that we're going to learn more and more about and have a different retrospective in 6 months than we do now, 6 months after.
Yeah, for sure.
But it's shocking already. And this is really just the tip of the iceberg. Because as you said, we're not done.
So I think it is important to go back and talk to those nurses and doctors, because they are on the front lines, and no matter what the numbers get fudged later on, they're holding the hands of people as they die. They're watching people choke because there aren't enough respirators to go around. They are putting their lives at risk because the federal government is undermining and overbidding state governments for equipment. It's really a tragedy. This is a tragedy. you know, it was already a pandemic. That's not a good thing. And it is really becoming closer to murder.
Yeah.
Because a lot of this death is preventable.
Well, a lot of it is preventable. And the statistics as it stands and pretty consistently have been, if the US had just matched with Canada, which you should be able to because we're pretty similar, we're right next door, you would have 120,000 fewer people dead. That's insane. And again, that's not the final number.
It's very hard to hear that because those are, every single one of those people is somebody's loved one.
Yeah.
Anyways, these are important documentaries to be looking into right now. Hear from the people on the front lines. Hear from the top tier medical officials. Science is important. Science is not a myth. It is irrefutable. And yeah.
Yeah.
It's out there.
It's the best guidance that we have. So use it. It should be pretty simple.
Yeah. Anyways, stay safe, everyone. Take precautions. Best of luck. And thank you for watching. Bye.
Bye.